Good evening, and welcome to another of the Distinguished Speaker Series, Houston Tomorrow, that is funded by the Anchorage Foundation of Texas. So we're very grateful to them for, I think this is about our 6th speaker, and they've been pretty heavy, and they keep getting heavier. In an intellectual sense. Yeah, I better watch that. I'm David Crossley. I'm president of Houston Tomorrow, and I'm always glad to see your faces, and I recognize many of you. And I know that you're out there working with us to try to improve the quality of life in the Houston region. One announcement: next week on Friday at noon, we're going to have a sort of a trial program on KPFT, and we'll be talking about the new Urban Corridors initiative and the mixed-use ordinance that is working its way through the city process right now. That will have a lot to do with whether we can produce walkable urbanism, at least around the transit stations in Houston. So tonight we're going to hear some extremely interesting stuff from Richard Jackson, who I actually heard 3 or 4 years ago, I guess, at a New Partners for Smart Growth conference. But I had seen his name well before that, and he and a few other doctors from the CDC and some other places have been trying to bring together this concept of health and the built environment with the sort of smart growth movement that is trying to say that quality of life can be improved if we think better about how we build our towns and cities and neighborhoods. And so he brought enormous quantities of ammunition to all of that argument, much of which you'll see tonight. And he's a passionate and really very interesting speaker about all of this. You've all seen his background, so I won't, I assume, because you got that message that we sent out to you 64 times, which worked, I see. And so without any further introductions, Dick Jackson.
So how many folks come out of the health/medical world in here? How many folks are out of the built environment, architecture, and design world? And how many out of the environmental world? This is perfect. I just love this. What did I leave out? John Q. Public is into all of them. Engineers don't. So, my big thesis here is how we build things affects people's health. We human beings are so adaptable that we quickly forget just how much everything that's going on in our lives is being shaped by the built environment. In my classes at UCLA, I talk about the built environment is social policy in concrete. And once we take social policy, we put it in concrete, we build a port, people are moving back, things are moving back and forth in the ship policy, ship channel, that social policy of how we deal with the people that are living there becomes a physical reality, which in turn reshapes social policy. So I won't beat to death that, but I'll leave this up as the start of this. And I think in 2008, 2009, we are at the intersection of a perfect storm. My cousin has a house in Maine, it's an old family sort of bungalow, piney thing on the coast. And if you go into the house, they have an area where you change to go swimming in the ocean. And there's a watermark on the side of the foundation that says Halloween 1991. And that was the perfect storm. It was called the perfect storm because it was this enormous storm coming across west to east, the typical patterns of storms. But there was a hurricane coming up from the south, up the seaboard. And then there was a northeaster coming down from Labrador and Newfoundland. And they collided off the coast of Maine. That was why it was called the so-called perfect storm, because we had 3 huge elements coming together at the same time. And I think we're in a perfect storm of social issues, which include health, of environmental issues. We're really at a catastrophic time for environmental issues, and of economic issues, which we will come back to in a few minutes. Anyone in the health world know what this is? It's a growth chart, right? And when you take your child or grandchild to the pediatrician, they'll put an X for the height and weight, and they'll track to see if your child's at 50th percentile or 75th percentile. And imagine doing a checkup on a 10-year-old boy, and he comes in, and on physical exam, he's found to be 50th percentile for weight, 50th percentile for height, 95th percentile for weight. His blood pressure is high for a child. His blood sugar is a little high for a child, but he's not diabetic yet. His cholesterol is too high, and he seems kind of depressed. So this is not a rare child. Pediatricians are now seeing 3 and 4 kids a day like this in America, and I'll come back to this. Good doctor says, you need a weight loss program, we're going to send you to the overweight clinic. No soft drinks in the house, you can't have them. Get a TV and the screen out of the child's bedroom and put other kinds of interventions in place. Encourage sports. And 2 months after that, the child comes in, he's basically lost 1 pound. Says, I can't change the food at school. Maybe it's a poor family and you take what you get, a bit of breakfast and lunches. There's no time for exercise. And by the way, the school got rid of PE and the after-school sports program. He can't stay because he's taken on the bus to school, and his mom can't really pick him up after school, so he has to leave at 3 o'clock. And when he gets home in his neighborhood, there's no place for him to walk. So 2 months after that, the child's on something for his blood pressure, something for his cholesterol, something for his depression. And we're spending about $400 a month medically to treat a child who has, in essence, disorders that are being driven by the physical environment that he is operating in, physical and social environment that he's operating in. By the way, this obesity epidemic I'll come back to is not rare at this point in America. And I would argue that the environment is being rigged against this child, it's being rigged against the healthcare people that are trying to take care of these children. This medicalization of all the problems we're looking at has had enormous costs. When I was a young pediatrician, we thought that 7% of all the money in the United States being spent on medical care was a huge amount of money. 7%. We're at 17% of every dollar in America now going to medical care. Notice, by the way, I don't use the word health care, and I forbid my students to call it health care, because it is medical care at the end of the disease progression pipeline, because we have not maintained health upstream. And that's my larger theme here, is what the people in this room do who think about the design of the world we live in. You're the ones who are purveyors of health. It's completely changed the economy of the United States. Of all the new jobs in the United States since the year 2000, 40% have been in the healthcare delivery system. You can't run an economy sooner or later if you fail to make things that all you're doing with your wealth and your smart people is taking care of other people who are sick. That is, it's not a wealth generator over the long term. And you would think with the enormous amounts of money that we're spending that we must be really healthy. And the colors aren't right on the screen, but what you're seeing in this picture is that the longevity, years of life that people are living. Are they getting longer or shorter in various counties across the United States? And where you see red or orange, these are counties where the lifespan is decreasing. This isn't an artifact of people moving out or anything else. This is all adjusted for using epidemiologic systems. So we're spending more and more, and we're living less and less long. At least a lot of us are, particularly groups that I'll be talking about. Now, 125 years ago, if someone said, well, what are the leading causes of death? The 4 or 5 top ones were infections. And we felt the problem of tuberculosis, for example, felt insurmountable. We thought, oh God, how are we going to turn this around? And we did turn it around. And we've added 30 years of lifespan to Americans, by the way. Of those 30 years, how many do you think came from medical care, and how much do you think came from changes in the built environment, changes in our food, changes in our nutrition, changes in our water, better housing, better built environment, and plus immunizations, public health measures overall. How much do you think of the 30 years came from public health measures, including built environment? How much do you think came from medical care? Just go ahead.
2010.
That's very good. It is. It's 23/7. So 23 years came from the changes in the built environment, housing, food, etc. I consider food and water part of the built environment anyway. And 7 from medical care. This is a picture of one of my heroes. This is a man who oversaw the Sanitary Commission during the Civil War and dealt with the survival of Union soldiers. This is Frederick Olmsted, the father of landscape architecture. He also built beautiful places. He did not understand that you had to partition health, physical health, away from mental health, and had to be away from built environment and social structures. He always saw it as whole cloth, that people could be healthier in places that were well designed and beautiful. And we forgot that in the 20th century because we got smart. Everybody can get in their car and they can drive away. And they can move to a nice neighborhood where it doesn't smell bad, even though they're making money down off the ship channel. And so we pulled people further and further apart. This is simply a slide of the decline in tuberculosis over the last 150 years. And you can see TB just dropping like a stone. It was all these physical changes. Antibiotics and vaccines really didn't make much of a difference. It really was. So I spent 15 years at the Centers for Disease Control and Prevention in Atlanta. The last 10, I was the director of the National Center for Environmental Health at CDC. It was a very complicated job. I had probably 700 CDC staff and about 700 contractors during that time. The director of CDC called up and said he wanted his 10 center directors to come into headquarters to talk to him and help him write the article he was doing for the Journal of the American Medical Association on the big threats of the 21st century. And the head of the Center for Health Statistics is saying the big threat is overpopulation. We have 600 million people over this same area. The head of the Chronic Disease Center is saying the big threats, the obesity epidemic and the diabetes epidemic that will come from that. The head of the Injury Control Center is saying the big threat, more years of life are lost because of injuries. You think that when you lose your life at 25, you lost a lot more years than if you lose it at 85. The big threat is injuries because that's the big killer of young people. And each one of us came in, and I'm head of environmental health, so I'm thinking climate change, chemicals in the body, chemicals in breast milk, and I'm going through an endless list of environmental issues as well. And I'm driving down Buford Highway in Atlanta, Georgia, 7 lanes wide of absolute beauty, without we had a suicide lane in the middle. And it's July, it's 95 degrees, 95% humidity. And I'm late, and I'm thinking all these big thoughts. I'm driving along, and I look over to the right side, and here's a woman in her 70s, and she's bent over, carrying a plastic shopping bag, one in each hand. And she's really struggling. She has red hair, and she reminds me of my mother. And I want to stop, and I want to give her a ride, and I'm late, and I don't do it. And I go to this meeting, and we're thinking all these great big thoughts, and all of things. God, if this poor woman collapses and dies from the heat, the cause of death will be heat stroke. And the cause of death won't be put down as lack of trees, poor air quality, blacktop roads, low albedo, lack of public transportation. If she's killed by a truck going by, the cause of death will be motor vehicle trauma, and it won't be lack of sidewalks, lack of public transportation, poor urban planning, and the real cause, failed political leadership. And in essence, in public health, we're always looking for the causes of death. When you start going upstream with these causes, Cecilia, it is inherently political. And you pretty quickly have a run-in with people saying, wait a minute, that's none of your business. You're supposed to take care of sick people, not intervening upstream and ordering us to have sidewalks or whatever else it is. So at this meeting, we picked the big 10 causes of death. An article appears in the journal on what the big causes will be in the 21st century. Here's 4 of them. And I would argue that every one of them is related to the built environment that we live in some form or another. The message of this building, and we built about 1.5 million of these structures every year, at least during the building boom of the prior 10 years or so. What's the big message of this building? What does it say is the most important thing in their lives? Cars, right? We had a 3-car garage. Yeah.
One might be an electric car.
You know, we moved to LA and I was looking for a condo, and every time we'd look for a condo, and I wanted a parking space, of course, because you can't live in LA with these. We're getting by with 1 car, but we didn't want to have 2. And I'd always say, well, where's the plug near my parking space? And he was looking like, what? Every car's going to need a plug near the parking space within 5 years. Here's the population of the United States, and here's what's going to happen. Just by 2050, we're up to about 450 million. I was born, it's 160 million in this country. It's about 10 million now. It'll add basically the whole of my lifetime again in the next 40 years, another 160 million people on an area of land that's going to be much smaller with climate change. We'll get into that discussion later. With a whole lot more old people, including me, and most of us, by the time, by 2030 or so, we're going to have 20 million old people in this country, not generating wealth either. We absolutely will end up facing substantial economic deficits. There's no way we continue paying Social Security or anything else. It will change the demographics and income of the United States in a profound way. I won't go into this in detail, but no matter what we do, none of the payments can go up because there's not going to be enough income coming in. There are going to be too many people pulling it out at the other end. So, as we think about the need for housing for older folks, guess where old people end up living? And everybody thinks that all the snowbirds up in New Jersey go to Florida, but the real truth is most old people stay in the communities where they live. They don't necessarily want that great big house with all the work that's attached to it, but they're going to stay in their communities. There are an awful lot of great big houses that are going to become much less attractive as residences for purely economic reasons. What we did over the last 30 years was we essentially removed 60,000 square miles of photosynthesis to build modern America. We essentially built modern America for automobiles. 25% of all the wealth in the United States was generated in the 20th century, came from cars in one form or another. That, by the way, is the equivalent area of the whole state of Georgia. So every time there's no photosynthesis going on over that, there's no oxygen being developed, there's no CO2 removal, and you got the equivalent area of the state of Georgia now being inert, or at least hot this whole day. We like to refer to this as the California state flower. We're very proud of it. And the problem with this is it only doesn't work after about 5 or 8 years. It plugs up just like an old arterial stent. The amount of driving Americans does has 2.5-fold increase since per person since when I got my driver's license. You got 2.5 times as much driving for every single driver, and we have 4 times as many drivers on the road. The reason you think it feels crowded? You start multiplying it by 8-fold, 9-fold, it's huge. And we've systematically resisted building transit. And I want to congratulate you because I love that. I rode the light rail this morning and it was really fun. I enjoyed it very I couldn't figure out the damn fares. It's kind of a mystery. Like, how should I put in there? The instructions weren't very good, but it was still a nice ride. Northwest Atlanta, Cherokee County, didn't want MARTA up there, the Metropolitan Atlanta Rapid Transit System. And without being insulting, Bob Bullard refers to MARTA as moving African Americans rapidly through Atlanta. And so Bob is the head of environmental justice and a good friend, African American leader. And what he means by this is too often in America we see mass transit as something for a disenfranchised or poorer population and don't see it as a mainstream need for everyone. So the folks up in, by the way, this is where Newt Gingrich and Bob Barr are from. They didn't want, and they literally used this term, public transit brings in the wrong kind of people. What's that code for? So they didn't build it, but Malthus got even with them. Because now the road is 23 lanes wide, and it's stopped 3 to 4 hours a day because there's been so much building up there. And they keep thinking if they just add 5 more lanes or 8 more lanes, everybody will be able to get back and forth. Sooner or later, they're going to have to extend Marta up into their, move an awful lot of people in the equivalent area of a few streetcars. But that, by the way, is social policy built in concrete in a most elaborate way. Big causes of death. More years of life lost between ages 3 and 33 due to car trauma. By the way, ladies, you know that men think we are better than average drivers. All men do. This is a mathematical inevitability. But how many miles do you have to drive to buy a 1 in a million lottery ticket to die? 66 miles. We divide, basically, on average, American dies every 66 million miles of driving. So if your commute each day is 33 miles each way, each day you bought a 1 in a million lottery ticket to die. Who is more likely to die in a pool of blood in America? This is a health issue. Is it a suburbanite, or is it an urbanite who's living downtown where there are some homeless people and there are other problems? Who's more likely to die in a pool of blood? You know, by the way, I asked this question, from an actuarial standpoint, it's the suburbanite doing the commuting who is far more likely to get killed. So here are the stats per 100,000 for getting killed in a car crash. You can see my former city of Atlanta doesn't do very well in terms of car crashes. Houston does better than Atlanta, better than Phoenix or Dallas. How about pedestrians? Houston does really well for pedestrians. I came down here to investigate how you do so much better than Atlanta and Phoenix at killing pedestrians. You didn't invent them, I know. So I asked my grad student, I said, could you figure it out per pedestrian, for actually how many were actually walking? And it turned out that you're pretty close to Atlanta when you actually figure out how many pedestrians are killed for the number of walkers that are out there. Pretty impressive how good New York and Philly are on that same scale. This is a huge public health issue. This is a complicated slide, and I apologize for putting it in here, but I'll only make one simple point. We all think that the cost of driving our car is 54 cents a mile because that's the IRS reimbursement rate. This is from this wonderful Victoria Transport Policy Institute. These are the true costs of driving your car. It's about 26 cents a mile for just your share of the depreciation of your car. Number 2 cost of owning a car is the cost of all the crashes and the insurance and the health care. If you divide up all those costs by the number of miles that are driven, the number 2 cost is crashes. The number 3 cost is vehicle operation. So think of all the money you spent in gasoline and oil changes and tires and brakes and everything else. And car crashes are more than that when you actually divide it out. And there are lots of other things, and I don't have time to go into the other ones, but it's pretty, I find it just amazing. So cars are wonderful. They get us where we want to go, but they raise our risk of dying in a car crash. By the way, we've made no progress whatsoever in reducing the absolute number of people who die in car crashes in America. It's still about 43,000. It has not gone down over the last 10 years in America. Now, the per mile thing has gone down somewhat because we've got better cars. We really want to reduce the number of people who die in car crashes in America. What are the 2 things we need to do? We got to get them out of there. The fewer miles you drive, that's the real way to reduce the absolute number of car crashes, is get them out of cars. Transit is about 40 to 50 times safer per mile traveled compared to car travel. And what's the number 2 way of getting cars to be safer? And yeah, you got to sober people up, and you got to do other things. But what's the number 2 way? You got to go slower, because the kill rate of the car goes up with a square. Very powerful effect of going up with the square of speed. Another way we kill people with cars is more indirect, and it's air pollution. So I've got an amazing question. If you add up all the people who die in car crashes, and you figure out, the burden on society of that, and then you add up all the people who die of automotive-related air pollution, which number is bigger? Air pollution, that's right. And we don't see it. It's not as dramatic as seeing somebody in a car crash die, but if the numbers when you calculate particulate air pollutants, ozone air pollutants, both lung disease and particularly heart disease, the numbers are larger. Go ahead, sir.
I'm not disputing it, but
How do you prove it? I can't go into great detail, but the simple version is if you extrapolate and you look at the amount of particulates, and you actually incrementally say, here's the particulates in this place versus this place, and here's how much heart disease increases. It holds up across the country, that holds up in Europe, it holds up elsewhere. The burden of particulates in the air, and it's biologically completely plausible, because most of the stuff moves in the lung. The very small particles move in the lung, can actually get right across the blood barrier in the lungs and get into the bloodstream and move to the heart and brain and the rest of the body, and decrease oxygen transport and raise your risk of heart disease. But here's a more dramatic one. Everybody can figure this one out. One of the major causes of air pollution after you got the cars is heat. The more heat you have, the more air pollution, the more ozone you get. And of interest, if you put in a lot of parks, you actually reduce ozone levels. If you maybe put green on top of the buildings, we reduce it as well. And if we keep lots of trees in rural areas, we keep the temperature down. Keeping the temperature down is a public health intervention. It's a real benefit. Let's get this. So here's a study one of my colleagues at CDC did. During the Olympics, we were all told, don't drive your car, the city will be too crowded, we're going to find people if they come into town. Driving dropped 30%, air pollution dropped 30%. So Mike Friedman said, gee, I wonder if I can figure out if there are any changes in asthma admissions to the emergency room during that period of time. Interesting natural experiment. What do you think he found? This is kids going to the ER, ages 1 to 16, for asthma. Medicaid, Kaiser, pediatric emergency rooms, and hospital admissions dropped during that time. Now, if you're from the trucking industry and you really want that federal money to go into new roads, you would dispute this and say the air pollution had nothing to do with it. People were having so much fun at the Olympics, they didn't want to go to the doctor, and that's why the rates went down. So Mike then did a comparison with the prior years and everything else that still was there, and then he did a look at other diseases like broken limbs and other such things, and they stayed the same. Air pollution really does put kids in the hospital. And here's a study we did in Los Angeles, colleagues of mine did. High air pollution schools, healthy kids that you would be proud of, 3 sports, go off to high school in the high air pollution area and the low air pollution area. At the end of 4 years, they went back and looked at lung function studies. The kids in the high pollution areas had 3.5 times the rate of asthma as in the low air pollution. This is not theoretical. This is real. Air pollution causes asthma and lots of other things. Now, we've built these 1.5 million of these structures all over America using this crushed worm pattern that you see across America. Suppose you're 8 years old, you live in this house, and you want to visit your best friend over here. You Twitter him, I guess, and say, hey, let's get together. So, all right, I'm coming over. And go over the fence and past the Doberman and the Rottweiler, and pervert and the guy with the gun, and over the next fence. And you get to your friend. Okay, of course you don't do that. You bicycle down here, and you bicycle around here, and you bicycle 3.5 miles to get to your friend's house, because that's how we build everything in America. What's the first word out of that child's mouth? Mom, drive me. Every mom in America drives twice as much as her mom did, and drove twice as much as her mom did. Isn't it because mom loves driving? It's because we built an America that is dependent on mom driving. If you build things with low density, people drive more. Prove it. The more time you spend in the car, this is done by my co-author, Larry Frank, the more likely you are to be obese. Is that kind of common sense? You just sit in there for long periods of time. That's what happens. The more you walk, the less likely you are to be obese. Black, white, young, old, male, female, holds up all the way across the more you walk. You knew that already. Walking's good for you, sitting is bad for you. This is pretty interesting, and this is relevant to this city. The more density and the better connectivity in the neighborhoods, more local destinations, interesting destinations people go to, he documented that you have less obesity. Difference, by the way, between a well-designed neighborhood with destinations is about 7 pounds compared to really sprawling neighborhoods. We have gained a lot more than 7 pounds. There are other things going on here. And so I want to talk to you about obesity. Here's rates of obesity in the United States in 1986. And I don't have time to explain it, but this is a body mass index. So what percentage of the population meets the definition of obesity with a body mass index over 30? So we don't have data from Texas in 86, but by 91 we have 10 to 14% of Texas obese in 1991. By 1997, 15 to 19% of Texas obese. By the year 2000, 20% or more of the state is obese. By the year 2004, over 25% of the state obese. 2005, a new color in Louisiana. And 2007, average Americans gained 27 pounds in about 30 years. Average girl, teenage girls gained 16 pounds over that period of time. Average 11-year-old boys gained 11 pounds over that same period of time. Getting obese is not good for us. Raises our risk of high blood pressure, of stroke, of heart disease, of gallbladder disease, of having a baby with a birth defect, of having joint disease, and a series of other medical problems. I'll come back to the biggest one, which is diabetes. This is a lousy slide, but the point of this slide is the data I just gave you is based upon 200,000 telephone interviews across the country. When the CDC went, or actually it was Harvard researchers went back and validated this, they discovered something you all knew already. And when you ask somebody on the phone how tall they were and how much they weighed, and then you actually ask them in person, they were shorter and fatter. And when you actually measured them, they were even shorter and fatter, and women fit more than men. But the larger point here is that people would say, well, that data is exaggerated. No, it's exaggerated in the wrong direction. It's actually worse than that. I was state health officer, and I answered to Governor Schwarzenegger for 1.5 years, and I was asked what my priorities were, and one of them I said was the obesity epidemic. And
Obesity, you know, that's...
No, you gotta do this. Obesity is a personal decision. It's not a societal decision. I said, no. When people will stay in the group. Any of you watch this? I haven't watched the show, but Mad Men, the Madison guys, right? They smoke all the time. They go drinking at lunchtime all the time. This is the way it was in the 50s. If your social culture was you smoked all the time, drank 3 martinis at lunch, it's kind of what you did. It's much easier to be healthy when everybody else is trying to be healthy around you. Look at the obesity. This is exceeding the 95th percentile for weight to height. Now our preschoolers are about 15% exceed the 95th percentile. I'd love our SATs to be that way, but our weight. And our school-age kids, 22% of our kids are overweight in our state, exceeding the 5th percentile. I'm sure Texas is exactly the same. It's changed everything about the world we live in. We're buying different hospital equipment, much heavier, 3 times as expensive because our patients weigh so much, and leading cause for nurses now leaving the profession. is back injuries. The ambulances are much heavier than they were in the past because they've got to transport much heavier individuals. And for fun, I did a calculation of how much additional jet fuel we burned off because we all weigh 10 pounds more than we did 10 years ago, each one of us adults on average in the United States. It came out to $1.5 billion worth of jet fuel just with our additional adiposity, which was the only study I ever did that was cited by Jay Leno, who said, CDC just announced that we burn all this jet fuel. And he said, now I know why the airlines don't give us food anymore. So there are other reasons for this epidemic. One is this, we've made this kind of food abundantly available. That's an awful lot of calories for somebody to eat in one meal. It's a bargain. We've created neighborhoods where it's much easier to buy a piece of fast food, particularly if you're poor, than it is to buy fresh fruits and vegetables. In fact, the stuff that's bad for us is cheap, abundant, and yes, tastes good. And the stuff that's good for us is much harder to get and more expensive. So when your child or grandchild says, can we get that supersized? You say, oh, that's a bargain. I can get 73% more calories for 17% more money. You have to think that every time you supersize a meal, you add 1 ounce of fat to your body. Men put it here, women put it here, but it's still 1 ounce of fat. Women, it only costs $3 in additional health care costs. Men, it costs $6 in additional health care costs. There's a lot, I'm sort of making fun of this a little bit, but there's a larger theme here that's an important takeaway. Too often in America, we've traded off, we want these short-term benefits, and we've reaped long-term costs. And we've got to do a full cost accounting of the decisions we're making in our society. It's everything from cars to transit to you name it. And in fact, the most hard-nosed business people say, well, I'm really a hard-nosed business person. We're going to make this decision because we make more money. But if you really look at all the real costs, it comes out different. Blaming a child for being obese is pretty awful when you think that in one generation we've doubled the number of ads that kids watch on TV. We've changed kids' diets profoundly. This is what I was taught was the food pyramid, and you all kind of remember this from school. You want to know what the television food pyramid looks? What we really tell our kids 40,000 times? I'm exaggerating, probably 5,000 of those ads are food ads. That's the real 5,000 times a year they're told, eat this stuff. And my pet peeve is anybody that puts red dye and blue dye in a food and then tells someone that this is berries and fruit ought to go to jail. You shouldn't be selling something that's fruit if it doesn't have any fruit in it. So we've talked about obesity, but as my body mass index goes up, I'm a male here, and on the back here, my risk of becoming diabetic goes up fourfold. If I'm morbidly obese, my risk becomes 42 times increased. If I were a woman, my risk of becoming diabetic if I were morbidly obese is almost 100 times. This is a big deal. Do you think then diabetes has gone up in America? Diabetes has tracked right along with our obesity rates since about 1990. There's diabetes in 94. Texas, can't tell the colors, between about 4 and 6%. 2001, 6 to 7%. In Texas in 2007, about, well, it looks like about 8%. We've almost doubled the prevalence of diabetes in our population for that period of time. That's why the colors are wrong. They're not laying, it's out of alignment. Look at the difference between in our Latin American population and black population rates of diabetes. This is the slide that got Governor Schwarzenegger's attention more than any of them. If the trends I'm talking about continue, 1 in 3 of all the little kids that you and I love so much will be diabetic in their lifetime, with an average reduction in their lifespan of 15 years, average reduction in the quality of their lives by 20 years. Your quality of life, if you're on dialysis and have gangrene of the foot, is not very good. It's my nephew Jack. I went to see him on Easter a year or so ago, and he was out skateboarding, and he came back.
Uncle Dick,
Hi, Jack. How you doing?
Uncle Dick, I gave up my fructose corn sugar for Lent.
I said, really? How was that, Jack? He said, oh, it was really hard. I went to the 7-Eleven and I searched the whole place for more than an hour, and the only thing I could eat in the whole place was Sweethearts. Look at all the stuff you eat and see how much high fructose corn sugar is there. I don't have time to talk about the drivers and all that. Look how much sugar is in a single soda. That's why the doctor said get the soda out of the house. 17 teaspoons, 250 calories. You can burn it off. You can exercise like crazy. Average American now consumes 63 pounds a year of this stuff. Remember I said built environment was not the biggest driver. It is how much we eat, but that's a lot of calories. In fact, it's 114,000 calories a year. And yes, you can burn it off. You need an exercycle, go to your desk, and pedal for about a quarter of the entire work year, and you can do it. I'm going to skip these. We've done something else. We've changed the environments. We've changed the social environment, the advertising environment, the nutritional environment for our children. We've also changed the walking environment for our children. 50 years ago, 80 years ago, we built schools as structures that reflected our respect and affection for education. We now build them more like medium security prisons, as much as I can tell. These schools were built in the center of town. That was a destination that most kids could walk or bike to. And then there was this idea that they ought to be built outside of town, and if they made them really big, kids could learn better. It turned out that was a theory. There was no science whatsoever to justify it, and the opposite was true. The kids in small schools learn better, behave better, and all the rest. I don't know if there are any architects here, but I'm told that the architects that build these also build prisons. I'm going to skip these. We put in place minimum standards for schools. 10 acres for grammar school, 20 acres for middle school, 30 acres for high school. Why did we need 30 acres in high school? Supposedly for fields, right? For kids to run around. But they're very expensive to maintain fields, so we paved them over, we call them asphalt meadows. And then the kids and the teachers park there because they're not close enough to their homes to now walk to school. We've finally gotten rid of that. Look at the change in how many kids walk or bike to school in America. We've gone from 66% of the kids in the country walking or biking to 13% of the kids walking or biking. Do you think that might affect physical fitness? Look at the change in my state. By the way, we put a fitness gram on our report card in California. It's 6 measures of fitness. One of the most difficult of them all is, can you run and walk a 12-minute mile? Danny, I suspect you can run and walk a 12-minute mile. You're not a high school kid. 3/4 of our high school kids can't run and walk a 12-minute mile. The implications for the future of our country are profound. By the way, 2 out of every 7 volunteers in the U.S. military can now not get in because of their lack of fitness and overweight. So, as we get to solutions, every child needs to be able to walk or bike to school. We've got to put in place safe routes to schools. Here's skip this. Yeah, my slides are a lot longer. This is walking and biking in Northern Europe. About 40% of the trips are walked and biked. Short trips are walked and biked. What do you think it is in the U.S.? 7%. David told me in Houston it's about 3% of short trips are walked and biked. I won't hold you to that, but it's, if you get off the plane in Copenhagen, you can sure see the difference between Americans and Northern Europeans, just in terms of our ability. We do everything we can to avoid, and we reserve exercise for you know, we're going to go to someplace, we're going to pay $50, $60 a month to go and exercise with everyone else and get on these step machines So my friend Howie Frumpkin says this is all part of the American Never Walk campaign. And this is Howie in the slide. He's my co-author of the book. Strategy number 1, don't build sidewalks. This is near our office at CDC in Atlanta, where we saw that lady. walking. Build repellent sidewalks. Would you really want to go for a walk in Florida and something like this? Would you like to take a wheelchair and go along that next to a busy street? Struck the sign. This is one of my favorites. Another place is interesting. A useful destination within a distance from where anyone wants to live. Just say it, no pedestrians. And make everything car accessible. Pharmacies, dry cleaners, liquor, baked goods, flowers, auto service, buying food, coffee is my favorite, banking, braille buttons for blind drivers, mailboxes. Only in Las Vegas do we have drive-through weddings, drive-through child support payments, and at the end of life, drive-through funeral homes. We have really married the car in the United States of America. So I'm going to move quickly on some more challenges, and then I'm going to come to solutions. One is I've talked about the health, social challenges, the economic challenges. You only know better. You know better than I. The jobs downturn in the United States. Last month they announced good news. We had only increased the unemployment by 400,000 in the United States. This is the prediction for how long this is going to run. I keep talking about it ending in the next year or two. I don't think it's going to end that fast. This is a long time coming, and things don't turn around that fast, particularly when we don't make anything. And the environmental challenges. If you drill down into the ice sheets in Greenland, and you can actually estimate how much carbon dioxide was in the atmosphere for 400,000 years, and what was the temperature for 400,000 years, you see these patterns go up and down. As the CO2 levels go up, the temperature goes up. Here's what's happened in the last 400 years. CO2 levels in the planet. Red line. The top Mauna Loa in Hawaii, they actually measure the CO2 level of planet Earth, of the atmosphere of planet